bed because of the severity of pain. And the pain is typically, it starts in the loin region or the flank. Regarding the bladder stones usually they cause burning in urine or sometimes blood in urine. Now coming to what forms the kidney stones. Kidney stones are mainly made by the calcium oxalate. Some stones also have uric acid, and there are infectious stones also that we call as struvite stones. What are the risk factors for formation of kidney stones? Dehydration is the most common risk factor, followed by high intake of protein. There is a low intake of fluids or warm climate, that is also one of the predisposing factors for formation of stones. Genetic predisposition, that means if there is a family history of kidney stones or metabolic diseases in the patient. Obesity and sedentary lifestyles are other risk factors for formation of kidney stones. Now, how do we diagnose the stones in the kidney or in the ureter? The initial diagnosis and initial assessment is usually done by the ultrasonography of the kidney, ureter and bladder region. But if I talk about the gold standard, plain CT scan of the KUB region, that means the kidney, ureter and the bladder, is the best investigations for the kidney or the stones in the ureter. Coming to the treatment, small ureteric stones, like if they are less than 5 millimeter in size, these are the stones which, when fall down into the ureter, these are the stones which might pass on their own, though they give you pain, but with the medicines and all, these stones, usually the patient pass off. So usually treat these patients with painkillers as medicines and some medicines which help the patient pass the stone in the urine. But having said that, it is not mandatory that all the patients who are having stones less than 5 millimeters in size, they will pass off on their own. There are certain group of patients like who are having single kidneys or who are having kidney failure, or they have some infection in the kidney, that means a very high grade fever or some infection focus is there in the kidney, then these are the patients which we need to address to surgically. Another modality of treatment is ESWL, that means extracorporeal shockwave lithotripsy, in which if there are small stones in the kidney and in the upper ureter part, we give them shock waves from outside the body, and stones are broken into small pieces and then they pass off into the urine. Then we have hospital stay is also just for one day. Now, what can we do to prevent the formation of kidney stones? Any patient who is having a kidney stone in his lifetime has a 50% probability of having the stone again within a span of 5 to 10 years. So these are the patients who should be on a lookout and they should be regularly getting themselves on a yearly basis for any formation of silent kidney stones. But we can definitely do some things to prevent the formation, the reformation of stone. The first and foremost is drinking plenty of fluids in any form. Then avoiding excess of animal proteins in the form of meat, restricting salt or sugar intake, regularly exercising and